Hello, I'm Kirsten Myers.
And I'm Kathleen DeVary.
As prenatal genetic counselors at EvergreenHealth, we understand you may have questions about genetic testing and what this means for you and your baby.
Today we hope to answer some of your questions and provide you with information so you are prepared for an in-depth discussion with your provider.
In this video, you will learn about what conditions can be screened, the testing options available, the reasons why you may or may not choose to have genetic testing, and your options moving forward. As you're watching, please remember that this video is not intended to replace the important conversation you should have during your appointment with your provider. The goal of this video is to help prepare you with the right knowledge to have this conversation thoughtfully.
Today there are many optional tests available, such as ultrasounds, blood tests, and diagnostic testing. These screenings can identify risk for health concerns, such as chromosome conditions, neural tube defects like Spina Bifida, and other genetic conditions.
In order to discuss chromosome conditions, it is important to remember that each chromosome holds DNA. DNA contains the instructions for how the body should grow, develop, and function. A typical person has 46 chromosomes in each cell of their body. These 46 chromosomes come in 23 pairs. One chromosome in each pair is from the person's mother, and the other is from their father. In order for a human to have typical growth and development, each cell of their body needs to have exactly 46 chromosomes. Too many or too few chromosomes will change the amount of information and will interfere with development.
All pregnant women are offered screening for 3 chromosome conditions during pregnancy. These are Down syndrome, also known as trisomy 21, trisomy 18, and trisomy 13.
Down syndrome occurs when a third copy of chromosome 21 is present in every cell. This third copy is called a trisomy. People with Down syndrome have a range of interests and abilities, but most will have mild to moderate intellectual disability and developmental delays. People with Down syndrome also have an increased chance for specific health concerns like low muscle tone and heart defects.
Trisomy 18 and trisomy 13 are rare chromosome conditions that occur when a third copy of either chromosome 18 or 13 is present. The majority of pregnancies with trisomy 18 or trisomy 13 end in miscarriage. Babies born with these conditions have a shortened life expectancy, typically a few days to a few months.
Most chromosome conditions, including Down syndrome, trisomy 18, and trisomy 13, do not run in families. The chance for these conditions does increase with a mother's age. However, most women have less than a 2% chance of having a baby with a chromosome condition. This means that there's at least a 98% chance that a baby would not have a chromosome condition.
Neural tube defects, including Spina Bifida, occur when the neural tube does not close correctly. This leaves part of the spine open. The nerves from the opening and down the remainder of the spine will be paralyzed and not function properly. The location of the opening in the spine determines a person's level of muscle control. Openings high on the spine can prevent movement of the arms and legs. Lower openings may cause paralysis of the legs, requiring the use of a wheelchair, but with normal arm function, while a person with a very low opening may have normal arm function and be able to walk. If there is no family history of Spina Bifida, the chance of having a baby with Spina Bifida is 1 in 1,000, or 0.1%. This means 99.9% of babies do not have a neural tube defect.
It's important to remember that all of these conditions are rare. Only 4% of babies are born with a birth defect, meaning 96% are not. There are many testing options available to screen for these conditions, and we encourage you to work with your provider to determine which tests may be right for you.
One type of screening is an ultrasound offered from 11.5 to 14 weeks of pregnancy. This screening measures the nuchal translucency, or NT, which is the fluid-filled area at the back of the baby's neck. The measurement of the NT is then compared to the length of the baby's body. Babies with a higher than expected NT measurement have an increased chance for certain chromosome conditions and heart defects. When an increased measurement is found, additional tests are offered to further evaluate the baby's health. Babies with a normal NT measurement have a decreased risk and will typically be offered standard testing.
Maternal serum screening is another form of screening that can evaluate the risk for chromosome conditions and neural tube defects from the mother's blood. Within this category of screening, there are 4 testing options: the combined screen, non-invasive prenatal testing or NIPT, alpha-fetoprotein or AFP, and the quad screen. The combined screen evaluates the risk for Down syndrome, trisomy 18, and trisomy 13. It combines the nuchal translucency measurement from the ultrasound with a blood test from the mother. The blood test measures a protein and hormone produced by the pregnancy that cross the placenta into the mother's blood. The combined screen catches 90% of pregnancies with Down syndrome and 97% of pregnancies with trisomy 18 or trisomy 13.
Non-invasive prenatal testing, or NIPT, is another blood test available after 10 weeks of pregnancy. The test measures cell-free DNA pieces from the placenta that cross into the mother's blood during pregnancy. The combined levels of cell-free DNA pieces from the mom and placenta are then evaluated to determine the risk of Down syndrome, trisomy 18, and trisomy 13. NIPT catches 99% of pregnancies with Down syndrome, 96% of pregnancies with trisomy 18, and 91% of pregnancies with trisomy 13.
Please keep in mind that while non-invasive prenatal testing yields highly accurate screening results, a diagnostic test is needed before making a definitive care plan for your pregnancy. Irreversible decisions should not be made based on screening results alone.
An alpha-fetoprotein, or AFP screen, is a blood test you can have between 15 and 21 weeks during a routine office visit to screen for spina bifida and other neural tube defects. The AFP screen catches 80% of pregnancies with spina bifida.
The quadruple screen, or quad screen, is offered to women that did not have a combined screen or NIPT. It is a blood test from the mother done between 15 and 21 weeks of pregnancy. The quad screen catches 81% of pregnancies with Down syndrome and 80% of pregnancies with trisomy 18. It also includes AFP and therefore screens for neural tube defects.
A positive screen or high-risk result on any of these maternal serum screens means there is a higher chance that a baby has a particular condition. If your screen is positive, your provider will refer you for genetic counseling to discuss further testing and help you determine the best care plan for you and your pregnancy.
An ultrasound at 20 weeks gestation is routinely completed to evaluate a baby's physical health and well-being. This ultrasound evaluates the baby's anatomy, such as the heart and brain, and also measures the baby's growth. It can detect more than 95% of babies with neural tube defects, such as spina bifida. An ultrasound at this time can usually show if a baby is a boy or a girl.
Remember, screening tests like ultrasound and maternal serum screening simply evaluate risk. They tell if the chance for a condition is high or low, but they cannot tell for certain if a baby does or does not have a condition. Diagnostic tests are meant to tell for certain if a baby does or does not have a condition. Therefore, the result of a diagnostic test can give a yes or no answer about a specific condition. Some women know they want testing that gives a definitive result, so they will choose diagnostic testing rather than screening. Other women may choose to have diagnostic testing only if they receive a high-risk screening result.
Diagnostic tests include chorionic villi sampling, or CVS, and amniocentesis, or amnio. Both CVS and amnio can diagnose chromosome conditions. Less commonly, they are used to diagnose specific genetic conditions when there's a known risk in a family. CVS is typically offered from 10 to 14 weeks gestation, takes a small sample of the placenta. Amnio is typically offered between 16 and 21 weeks gestation and takes a small sample of the fluid from around the baby. Because CVS and amnio are invasive procedures, they both have a small risk of causing miscarriage. The risk of miscarriage due to either CVS or amnio is less than 1%.
As you consider which prenatal testing and screening options are right for you, we encourage you to think about a few things. How would you feel if the test result shows your baby is at high risk for one of these conditions? How do you handle uncertainty? Would you consider having diagnostic testing if your screening result is high risk? Would you want to know if your baby has a health condition before birth? People choose to have prenatal testing for many reasons. They may want testing to learn more about the health of their baby. They may simply want the reassurance that all is well. They may feel that the results will help them make informed decisions about pregnancy management, help them prepare for delivery, or help in making decisions for the baby's care after birth.
People choose to decline testing for many reasons. Some want to avoid the potential stress they might feel if they were to get a high-risk result. Some don't think the tests will help them plan or make decisions, while others feel that it's not information they want to have until after the baby's born. Only you can decide if prenatal testing is right for you based on your beliefs and personality. As your healthcare partner, we are here to provide you with information to support your decisions about genetic testing during pregnancy.
Another type of testing offered prior to pregnancy or during the first trimester of pregnancy is genetic carrier screening. Carrier screening is performed on adults to determine if they carry any specific genetic changes that would put them at an increased risk to have a child with a genetic condition. Carrier screening commonly includes testing for cystic fibrosis, spinal muscular atrophy, and Fragile X syndrome.
Cystic fibrosis and spinal muscular atrophy are both recessive genetic conditions. To understand recessive genetic inheritance, it's important to remember that we all have 2 copies of every gene. A healthy adult can carry one non-working copy of a gene as long as their other copy works normally. These individuals are called carriers because they carry the non-working copy of the gene but do not show any health effects. However, a carrier can pass the genetic change on to their child.
If both parents carry a non-working copy of the same gene, they may both pass this non-working copy to a child. If a child has no working copies of the gene, they would have the condition. If both parents are carriers, each of their children has a 1 in 4 or 25% chance of only inheriting non-working copies of the gene and having the condition. Remember, this means each of their children also has a 3 in 4 or 75% chance they would not have the condition.
People with cystic fibrosis, or CF, typically have respiratory and digestive problems that can range from mild to severe. Due to chronic lung damage, the average life expectancy for people with cystic fibrosis is currently approaching 40 years of age. Although treatments are continuing to improve and the average life expectancy is increasing. Newborn screening in Washington State automatically includes testing for cystic fibrosis at birth because early diagnosis and treatment improves the health of children with cystic fibrosis. The chance of being a carrier of cystic fibrosis varies based on ethnicity. As you can see, 1 in 25, or 4% of all Caucasians are carriers. If both members of a couple are Caucasian, they have a 1 in 2,500, or 0.04% chance of having a child with cystic fibrosis. If you have a family member with cystic fibrosis, the chance of being a carrier is higher than the chance based on your ethnic background.
The carrier frequency for spinal muscular atrophy, or SMA, is not based on ethnicity. 2 to 3% of all people worldwide are carriers. Spinal muscular atrophy destroys the nerves that control muscle movement. SMA leads to progressive loss of muscle control, eventually affecting the muscles involved in breathing. 60% of people with SMA have a severe form with a life expectancy of 3 years or less. However, milder forms of SMA do exist. Spinal muscular atrophy testing is not part of the state newborn screen because there are no early treatments to improve the health of people with the condition. Without carrier screening in the parents, most children with SMA will be diagnosed with the condition around 6 months of age.
Fragile X syndrome is inherited in an X-linked fashion, meaning it's a change on the X chromosome. Women have 2 X chromosomes, men have 1 X and 1 Y. If a woman carries a changed gene on one of her X chromosomes, the other X chromosome can make up for the lost function, so the woman would be a healthy carrier. If a man has a changed gene on his X chromosome, the Y cannot make up for the lost function, so the man would have the condition. If a woman is a carrier of Fragile X syndrome, each of her sons has a 50% chance of inheriting the changed X and having an increased risk for Fragile X syndrome. Each of her daughters has a 50% chance of inheriting the changed X and being a carrier for Fragile X syndrome. However, due to the complexity of Fragile X syndrome, some of her carrier daughters may have symptoms of Fragile X syndrome.
Fragile X syndrome does not cause physical health problems or decrease life expectancy, but it is the most commonly inherited form of intellectual disability and autism. Only 1 to 3% of people with autism actually have Fragile X syndrome. Therefore, this test does not significantly alter the possibility of having a child with autism for most people. The carrier frequency for Fragile X syndrome does not vary based on ethnicity. Worldwide, about 1 in 260, or 0.4% of all women, are carriers of Fragile X syndrome. The chance of being a carrier increases if a woman has a family history of intellectual disability, mental retardation, autism, early menopause, or female infertility.
Fragile X syndrome is not part of state newborn screening because there are no early medical treatments for the condition. If carrier screening is not completed, children will typically be diagnosed between 2.5 and 3 years of age.
Other conditions that can be included on carrier screening include hemoglobinopathies, which are inherited blood disorders like sickle cell anemia and thalassemia. Carrier testing for hemoglobin disorders may be offered based on results of blood screens completed early in pregnancy or based on race and ethnicity. People from some racial and ethnic backgrounds have a higher chance to be a carrier of a hemoglobin disorder, including people with African, Mediterranean, Asian, and Middle Eastern ancestry.
There are other racial and ethnic groups for which additional carrier screening is recommended. This includes people with Jewish ancestry, French Canadian, Cajun, or Acadian ancestry, and Amish ancestry. There are specific conditions that are higher risk for these populations. Some providers also offer expanded carrier screening that tests for a large number of recessive genetic conditions. This may be especially useful for people with mixed racial or ethnic backgrounds and can also be useful for couples who are related by blood.
If screening determines that a woman is a carrier of one of these conditions, the father of the baby is then offered carrier screening. If both are found to be carriers of the same condition, they are offered genetic counseling to discuss their testing options. These options include diagnostic testing to determine if the baby inherited the condition. Diagnostic testing can either be completed during the pregnancy or at the time of delivery.
As you are considering your prenatal testing options and what testing may be right for you, please keep in mind that no test screens for all genetic conditions. While this video is intended to provide you with a basic understanding of options available to you, we encourage you to talk to your provider.
Genetic counseling may be recommended or especially helpful if you are 35 or older at delivery, have a family history of intellectual disability, autism, birth defects, or other conditions, have had an exposure during your pregnancy to medications, infections, or other substances, you and your partner feel differently about testing, you are feeling anxious, or you would simply like more information.
We welcome your questions and invite you to arrange an appointment to empower yourself with the knowledge to make the best decisions for you and your growing family. you.